Hello, my name is Leslie Jackson, and I am the Senior Administrative Program Coordinator for the ACT LEND program. And LEND is a pretty long acronym. It stands for Leadership, Education, and Neurodevelopmental and Related Disorders. And we bring the Autism Consortium of Texas to everyone once a month. So we're so excited to see that you all joined us today. I have just a couple of housekeeping issues. One is if you registered to receive a CEU certificate, know that it takes me about a week to send those out. So you should receive them a week by next Friday. And then the other thing is attending the entire presentation is a requirement in order to receive a CEU. So just so you know that. And I see we have a question here. Hold on, let me see. So I'm gonna hold on the question for a moment, and we'll get to those at the end of the presentation, but I will try to chat you once Dr. Siller gets started. So I'd love to introduce our speaker for today, Michael. It's Dr. Michael Siller, who's presenting on supporting children with autism in naturalistic settings, creating an ecosystem of care for children with autism. Dr. Siller is a developmental psychologist studying how children with autism develop and learn. He's particularly interested in learning that occurs in familiar daily routines and in natural environments. Dr. Siller co-founded an inclusive, university-affiliated laboratory preschool focused on autism and professional developmental programs for community-based preschool teachers. As the director of the UNT Kristin Farmer Autism Center, Dr. Siller strives to integrate clinical and educational services and aims to support the implementation of evidence-based practices in community settings. Dr. Siller's research has been funded by the National Institutes of Health and numerous private foundations. Dr. Siller co-edited the Springer Handbook of Parent-Implemented Interventions for Very Young Children with Autism, and his articles have been published in leading journals. And now I will turn it over to Dr. Siller. Thank you so much for joining us.
Yeah, thank you so much for having me. It's a pleasure to be here. So I, as Leslie said, I'm the director of the Kristin Farmer Autism Center here at UNT, and I just started this new position just this summer. So I thought, in the spirit of new paths for my life, I would sort of use this talk to think back and tell you a little bit about the work, where I've come from, the work that I've done, and how my thinking has evolved over time, and then use this as an opportunity to sort of pause and think ahead of what I hope to accomplish here at the Kristin Farmer Autism Center, where I see the future for us, but also really for the autism community here in Dallas and beyond. So thanks for indulging me on this. And I think we decided that if you have questions, you can put them in the chat, but we'll reserve some time in the end for you guys to ask the questions then. If there's anything urgent coming in, Jessica, feel free to butt in as well.
Okay.
So I'm going to talk to you about work that I've done during the last 2 decades. There's lots of people I've worked with. Connie Casari, Danielle Messenger, Lindy Morgan, Emily Rubin, Catherine Picard. So a lot of people have contributed to the work that I'm presenting today, including lots of students, pre-doctoral, undergraduate student, doctoral students. There's also lots of different funding agencies that contributed and funded this work, and I'm incredibly grateful to them. I'm incredibly grateful to all the families who helped me shape my work. In terms of disclosures, I'm employed here at UNT, and I direct the Kristin Farmer Autism Center, but I don't have other financial conflicts in this. I wanted to sort of frame this a little bit by how I think intervention researchers at this point think about autism interventions. I think during the last decade, what has happened is that the field has sort of, at least the research field, has sort of coalesced around a framework for how we think about early interventions, particularly when it comes to skill building interventions. And the phrase that's been coined for those is naturalistic developmental behavioral interventions. So this has emerged as a framework for the field, probably much more in the research community than in the sort of service delivery community. But that's sort of what I would like to sort of anchor my presentation in. And I think what's essential to this is that we sort of have this idea that, at least to the extent possible, learning opportunities for kids with autism should be embedded in their natural environments. And that includes embedding learning in play and familiar daily life routines. And it also means that learning is embedded in quality relationships with other people. I'm sort of describing this as a framework. I don't think it's really a specific intervention approach that has been tested in a way that it's better than others. I think there's part of it that pieces of it have demonstrated efficacy above other things. But I think this framework really, I see it much more as a research paradigm that has evolved, that it's a perspective that us who think about autism intervention have sort of coalesced around. And part of it has to do that we think that contingency-based skill building is most effective when it's embedded in motivating activities, in play, in familiar life routines. And we have been suspected that for a while, because if it's not embedded in naturalistic settings, it's not going to generalize. But I think that's only part of the story here. I think the other part of it is that the field has understood that intensity matters. And if we want to give children access to intense interventions and want to do so in a way that all families have access to this level of intensity, the only way to really do this is to engage parents and teachers and other people in children's lives into the service delivery. I think it also is a reflection, our thinking about naturalistic developmental behavioral intervention, of how our views on disabilities have changed and how we now think much more about acceptance and inclusion and respect for differences and neurodiversity. So I think this framework has emerged in that context as well. And the other thing is that we now have a whole science that concerns itself with how we take what is working into communities and make it work in community settings. So the whole field of implementation science is all of a sudden available as a tool that helps us take some of these evidence-based practices that are developed in research settings and take them into teaching parents, teaching teachers, and teaching people that children meet in the community. So naturalistic developmental behavioral intervention is sort of this framework that really thinks that, or believes in the fact that that learning should occur in natural environments to the extent possible. And there are many reasons why we as a field have ended at that conclusion. So I'll take you a little bit through my sort of development in thinking about this stuff. I started out 20 years ago thinking a lot about how to support parents and how to create learning opportunities at home. And then, so I did that first at UCLA as a graduate student and as a postdoc, and then also at Hunter College, where I had my first faculty appointment. And then in 2016, I took a position at Emory University at the Marcus Autism Center, where I spent a lot of time thinking about inclusive preschool environments. So I'll tell you a little bit about my work in that field. And then I'll tell you a little bit about how I sort of envision using my experiences to become an architect of an ecosystem of care for children with autism here in Dallas. I should say that I know we all are becoming very attentive to how we talk about autism or children with autism or autistic people. And I know that the field doesn't really have reached consensus on how we name people with autism or autistic people. So if you hear me use both the phrase person with autism, child with autism, or autistic persons, it's an effort to be respectful of the different perspectives in the field about identity first or person first language. So when I first started doing research, so in 1997 is when I was just finishing up a master's degree in Germany in psychology. And I decided that I wanted to come to the United States to learn about research, to learn the language, but also really learn about autism, because at the time it felt like in Germany there was very little to know. I had just finished at the time a year of a clinical internship in an autism clinic in Germany, and I put in the top corner here this little book that we read at the time. It's translates from playful to verbal dialogue with children with disability. And I put this here because I loved it at the time, and I still love it. In many ways, and I'll come back to this, the way this book taught me, the way I thought about how you support kids with autism at the time has really not changed a whole lot between then and now. And there's a lot of continuity. Other things have really changed in how I think about things, but that's sort of one of the things that changed. And that was also noticeably different when I came to the United States, because when I came here, so I ended up working in Marion Sigmund's lab at UCLA for an internship at first. And Marion at the time, so many of you may know Marion, she is one of the pioneers in autism research. She's done a lot of longitudinal studies, a lot of following children, a lot of learning about why joint attention matters and what joint attention is, and following children to understand what it predicts. And at the time, she had a grant where she went into the homes to videotape parents play with their children. And she had the idea that probably what parents do with their children matters, which was a fairly novel idea at the time. And it's sort of hard to understand now looking back, but it was a very novel idea. Nobody else thought of parents as an agent of change for children with autism, really. But even when you looked at her grant and the way she thought about it, the underlying idea is what helps children with autism learn language is if parents are structured with their children. So the idea of structured teaching was, even for people like Marion, was a very the idea about how intervention should work. And I sort of came in part with this red little book in my head, sort of thinking, well, maybe it's also responsiveness that matters. Maybe it's really much more, just like we think for typical developing kids, really parents spend a lot of effort being responsive to children's attention and intentions and goals and strategies that may matter too. So I went into Marion's archives and I looked at old videos of parent-child interactions who at the time were adults. So she had this large archive, and I coded parents' communication with their children. And I had this very surprising finding at the time, which was that the degree to which parents were able to be responsive during early play interaction with their preschoolers predicted language up to 16 years down the road. And the correlations were really strong and could not explain by any child characteristics that we measured. That was a very novel finding at the time. I think looking back at it from now, it sort of seems common sense in many ways, but at the time it sort of put data to something that really wasn't out in the literature in that shape or form. So then we tried to think about why that would be. And at the time, Michael Tomasello was in Germany, so I knew of his work, and Marion was friendly with him. So we sort of considered his framework for thinking about why that kind of responsive language parental language may help children acquire language down the road. And essentially his framework is the following. the idea is that at about starting 15 months of age, typical developing kids, when they hear a novel word that they don't know, they use social or pragmatic cues to try to interpret what they hear. So they look at what is the speaker paying attention to, what are they looking at, what's the context, are there other words that I already know that help me interpret what's going on? And kids starting at 15 months, typical developing kids start using those cues when they don't know the word. But before they have that skill, what we see in typical development is that parents work very hard to talk about things the child is looking at, to verbalize and articulate intentions that the child has, and really work very hard to keep their communications as transparent to the child as possible. So that was sort of our framework for thinking about kids with autism. So maybe if kids with autism, just like very young typical developing kids, lack the ability to read other social pragmatic cues, maybe they also would benefit from language that's particularly mindful of what the child is interested in and attending to. So in a second longitudinal study, we sort of replicated this early finding now over 4 years, and again sort of found that there were two things that predicted children's language development independent from each other. One thing was the degree to which children were able to interpret others or use others' social pragmatic cues. So whether they were able to follow others' pointing gestures, for example. And the other thing above and beyond was the extent to which parents were able to comment and describe what the child was already attending to. So it seemed to us that language development really was about both. It was about children being able to interpret nonverbal cue or contextual cues in their environment, and also the parent's ability to be really responsive to what the child is attending to and trying to do and following the child's lead. So that was a pair of longitudinal studies that we've done. Obviously, correlation does not imply causation. Just because it unfolded that way longitudinally, there may be other variables that explain what's going on. So it was a consistent finding. We don't know exactly the reasons. The theory that I just laid out to you is a theory at this point. So really, to get from correlation to causation, what you want to do is experiments. So we did 2 clinical trials. We essentially developed an intervention program to help parents be more responsive during play, and then try to test that in 2 clinical trials. And the first clinical trial was completed in Marion's lab at UCLA between 2001 and 2007. And that was an NICHD funded, so funded by the National Institute of Health grant. And then in between 2008 and 2012, I completed a clinical trial at Hunter College of the City University of New York then. These trials were very similar in many ways. They tested the same intervention. They were both pretty large, at least for the time, with about 70 participants. The first clinical trial was just one site. The second clinical trial was multi-site, which means we did the same intervention and procedures was implemented in New York and also in Los Angeles. The age was really the big difference. For the first trial, we looked for preschoolers, so 3 to 7-year-olds. And that was largely due to the fact that younger children with autism at the time just weren't identified. And then the 2008 study was funded by Autism Speaks right after the Academy of Pediatrics study published their guidelines for screening and diagnosing autism in toddlers. So then there was the surge for intervention specifically for that very young group of children. So was the context for this intervention. So it was really high-risk toddlers. So 2 clinical trials, both very similar, both trying to test the idea that maybe if you help parents structure play interactions in a way that allows them to be responsive to their children, whether that has an impact on children's language learning or learning broadly throughout. So I'm going to tell you just a few things about this intervention. I'm describing this here in a little bit of detail because I think since then there have been I don't know, a dozen other interventions that are all very, very similar to it. So the intervention that I developed was called focused playtime intervention, but I think you could substitute this for, or when I talk about it, think about things like Project Impact, or the Early Start Denver parent model, or the CERTS model from Amy Weatherby. There's really lots of different models, or a number of different models that have been developed and tested, all of them having very similar findings, really. So the intervention that I've developed, just in terms of structure, it was short and brief, 12 sessions. It involved a range of strategies to help parents learn. So there was some didactic education, there was some video feedback is what we did a lot, where we videotape parents and then we play with their children, then sat down with the parents and reviewed the videos and tried to, see what's working and see what ideas we have for doing things differently. And then there was lots of live modeling and live coaching. We manualized the intervention, we used fidelity measures, and we had a parent workbook, which was sort of one of our tools. On the right, you see pages from the parent workbook, and I'll just scroll through a little bit. So there were sort of more didactic pages. They were all very simple, lots of pictures. There were some pages that were sort of like forms where parents would write down their observations and thoughts, maybe even some checklists that parents could keep for their children. There were some homework assignments for things parents should pay attention to when they have play interactions with their child during the week. So there was this workbook. Overall, it was a very family-centered approach. We tried to make sure we answered parents' questions. We tried to stay in families' natural environments. So all of this happened in families' homes. We made sure that parents were not just lectured, but active participants in the interventions, and that they learned not only skills, but also the capacity to really reflect about what their child does, what they're thinking, what they're doing, what they need, and how their engagement helps them learn. And there was a structure to it, and this again is also very similar to things like the CERTS model or the Project Impact, where the first stage of this intervention is to really focus on helping parents pay attention to what is the child doing, are they paying attention to, what are they interested in, how do I use my language to comment on what the child is doing. And then once you have the joint engagement created, then parents use that for teaching children new skills. So it's sort of, Amy Weatherby calls it the layer cake. We have this little stack pyramid, but it's sort of assumes that the foundation is that you first create a shared activity, a joint activity routine, as they would say in ESDM. And then once you have them engaged, then you can start teaching them. We've published a number of papers on it, and I'm not going to go into too much detail. I just want to give you a big picture of the results. But before I do so, I want to give credence or credit to Michelle Bankman, who, at least in my head, helped me a lot of thinking about intervention efficacy. Because I think in old school thinking, we used to think, well, we do an intervention and then we do a clinical trial. And if we have treatment effects, then we call it efficacious, or we think it has efficacy. And I think what Michelle Sandberg really helped us think about is that the outcome really matters. It doesn't just matter that we have a treatment effect. What's more important is, what is the treatment effect for? Like, what behavior does it change? And there's really two dimensions that we have to think about. There's one thing she called boundedness. So that's a lot of when we sort of think about generalization. So if we teach something in one context, does it generalize to a different context? So if I teach my child how to request food around dinner time, does that generalize to requesting toys during a toy session, or does it generalize to how to request toys from peers? So this idea of generalization is really important. So how much, so if we teach our children something, how far does it really generalize? And the other dimension that she emphasizes is the concept of proximity. With a lot of our intervention that sort of have a developmental framework, we have sort of deep down the idea that we target some core deficit. And if we address this core deficit, eventually it's going to have a big impact down the road. So if we target joint attention, we implicitly assume that it's going to change children's language development. But that needs to be empirically demonstrated. So if we think about what is the intervention, does it have an effect? We really want to think about sort of a continuum. So if I think about parent coaching interventions, at the very narrow level, what I'm trying to change is how parents look at their children and how they feel about their children. And then I want to change how parents are interacting with their children. And then I want to change how children interact with their parents. And then I want to change how children interact with someone they don't know, like a tester. And then I want to change how children interact with kids in school. So there's this continuum of outcomes. Some of them are much more proximal, and some of them are much more distal. So when I think about, is an intervention efficacious, I really think about that continuum and think about how far do the treatment impacts reach. So if I think about my work now with a little bit of distance that I did on parent coaching and how far the impacts reach, I would say the following. I would say this parent coaching absolutely changes how parents think and feel about their children. They become much more attentive. They're much more articulate in describing what is going through the child's head. They're more articulate in thinking about what they do themselves to help their children learn. I think it's also, my work has shown this, and other people's work has shown it too. Parent coaching absolutely changes what parents do when they interact with their children. So parents become more responsive. They use some of the skills that we teach them. That's feasible. Now, when we think about how children interact with their parents, we did see some impact, and other groups have too. One of the outcome measures that I'm emphasizing here are attachment-related behaviors. I think we're the only people who've published on this, but what we used is the strange situation, where parents leave the room and then come back into the room, like an assessment room where the parent and the tester are together and playing, and then the parent leaves the room and comes back in, and you sort of look at what the children do when the parent comes back in. Do they pay attention? Do they greet? And what we see is, after an intervention like that, children with autism are much more eager to seek contact with their parents, which was a beautiful outcome. Other people have shown treatment gains in nonverbal communication, for example. In terms of children's language development, so language tests administered by an independent tester, we found some effect, but only for some children. So it was a less clear picture. Interestingly, we found that our intervention, sort of consistent with Mike Tomasello's theory, that our kinds of intervention where you focus on responsive communication is most effective for the children who have the least amount of language to start with. So it seems to suggest once the child already is talking, these responsiveness strategies are not as powerful by themselves as they are for the children when they learn their first words and their first communications. And we didn't look at school outcomes. So I think the picture that we have from these parent coaching interventions, they definitely do something. They are often not powerful enough to really generalize all the way through, to help children demonstrate generalized skills in different settings. So we can come back to this, but this is sort of the story that how I would sum up my work on parent coaching. I think it's also the story of how I would sum up the entire field of parent coaching in science. So that was sort of one trajectory that I went down, where I tried to think about, well, how could teaching work when it happens in children's homes? And then I left Hunter College and I started working at Emory University at Marcus Autism Center. And that's where I started thinking much more about how does this look like in preschool settings. Again, if we think about the places where young children typically are, it's either at home or in preschools. So I wanted to have a look at preschool specifically. At the time, we felt that looking at educational settings was really ripe, in part because educators started talking about lots of things that were closely related to what we autism researchers talk about. So they talk a lot about universal design for learning. They talk about social emotional learning. They talk about foundational learning skills. They talk about inclusion. So it seemed to us that the education field was really ripe for us to think about autism interventions more concretely. We thought the autism science was ready, just because the autism science has really shifted away from thinking about decontextualized teaching towards teaching in natural environments. And we also felt that the research methods had come a long way away from just testing efficacy to implementation science methods. So I did 3 things at Marcus, and this was all done in collaboration with Lindy Morgan. First, we decided we wanted to start our own lab school, an inclusive, university-affiliated lab school for kids with autism, to get sort of a first-hand understanding of what it takes to create a program that helps kids, a preschool program that is inclusive and helps kids with autism learn. So I'll tell you a little bit about that. And then I'll also tell you about 2 NIH studies that we've completed. Essentially, well, the first one is completed, the second is underway, but both of them are essentially an effort to take what we learned in our lab school and think about what are the implications of that for the community preschools down the street. So I'll start by telling you a little bit about this preschool, which eventually was named the Louise and Brett Samsky Preschool. We started this in 2018 and started just with 1 classroom for 2-year-olds. And then every year, well, for the following 2 years, in August 2019 and August 2020, August 2018 and August 2019, we added a 2nd and a 3rd classroom. And then since then, we have gradually sort of improved the program over time. So it's still active and running and doing real well, even after I've left. One thing that, I mean, as you sort of may have gotten the sense already when I talked about the parent coaching intervention, here again, building this intervention, I really like to tinker with things. So I think the craft of developing programs is something that gives me a lot of joy. And I found this developing a preschool program really powerful because it has a huge impact. I always used to joke that we were responsible at Marcus Autism Center, which is a big building. We were responsible for the most footsteps in the building just because we had so many kids come through. I totaled up the number here just for fun. I think we delivered 250,000 hours of direct services to children, both with or without autism. We had 400 kids coming through our eligibility procedure, 146 enrolled in the program. So this is just over the span of 4 years. So you're touching a lot of kids when you develop a program like this, and it's beautiful. The way we structured this program, and this is different from other inclusion preschools that you may have heard of or come across, is we intentionally designed it that it resembles a preschool in the community. So we didn't want this to be a program that's funded through ABA service or through anything fancy. We wanted this to be a program that essentially exists under the same condition than a community preschool would. So that means we had 3 classrooms. The class sizes increased a little bit by age. So we had 2-year-old, 3-year-old, and 4-year-old classrooms. The class sizes increased from 2 to 18 years. The younger 2 classrooms were tuition-based. The pre-K classroom in Georgia was a public pre-K classroom because the state funds pre-K classrooms. Each classroom had 6 children with autism. It was a full-day classroom, and each classroom was staffed by 3 teachers, a lead teacher, and 2 assistant teachers. So this is what you would see in terms of number of kids and number of teachers and qualifications of the teachers. It resembles what you would find in a high-quality preschool in the community. And that was sort of important for us, just because we thought if we want this to be a model that generalizes to the community, we couldn't leverage or have access to much more resources and services than they would. What the staffing formula meant, though, is that we had to be really mindful about eligibility. So we did not walk in there assuming that all children with autism would be a good fit for this. Instead, we sort of put quite a bit of thought and tinkering into thinking about who's ready for this. And essentially, we came up with sort of a process for determining readiness for this program. So if not for inclusion in general, but for this program specifically, where we looked for children who paid attention to and were interested in other children, who had started to communicate, maybe with gestures, eye contact, some with short phrases, who had some skills in playing with toys functionally or in a pretend manner, and who didn't have significant behavioral concerns. That sounds like a long list. I think we could have a long conversation about where we would set the bar, and the bar certainly differed for the 2-year-old classrooms and the 4-year-old classroom as well. But to us, to me, I think that the important message is that when we structured our classroom the way a community preschool would look like, it meant we couldn't accommodate all children with autism because some children need more than that. But looking at our numbers, I would say about half the families, at least half the families who sought of children with autism who sought eligibility were found to be eligible as well. Just looking at the time, I'm going to scroll down a little bit quickly. I'm just going to tell you about the curriculum, and the goal setting is that we use the creative curriculum, which is one of those preschool curricula that many people use, and we've developed goals, individualized goals for children using the CERTS framework. If I look at our goals now that I direct a center that does a lot of ABA, I'm sort of struck by how simple our goals were, and there's a beauty in it. We essentially had 4 goals for each child, 2 goals in communication, focusing on both form and function of communication, and we had 2 goals in emotion regulation, helping children regulate their own emotions, which also meant regulating emotions, particularly when children needed to transition in the classroom. So it was emotion regulation and managing transitions, either for themselves, so give them tools to regulate themselves, or help giving them skills to regulate their emotion in collaboration with other people. So seek the teacher's help in regulating their emotions. All right, so we had developed this preschool program, and then we did 2 research grants where we tried to take what we learned from this intervention, from this preschool program at Marcus, and how this would look like if we develop a professional development tool for teachers in the community. And I'll just sort of talk you through this a little bit. So the first study, we became very aware that, the inclusion preschool at Marcus was not the only one. There isn't a huge number of programs out there, but there are a few of them. So very early on, we sought peer institutions, so other inclusive university-affiliated preschools that we became aware of. And we were very curious to see what they did and how effective they were and where they saw their barriers and opportunities. And we didn't find a whole lot, but we found 12 or 13, and we founded this inclusion network, which is still going on. We actually just published our first paper from this network. So a lot of the thinking that that I'm presenting really comes out of the thinking of this network, sort of the challenges that all of us university-affiliated inclusion preschools faced. All of us have in common that we all believe in naturalistic teaching, and somehow we have this idea of these strategies that are evidence-based, and somehow we try to blend them with what teachers do in early childhood education settings, blend the two things together, and make the interventions work. Looking back, some of these programs have been around for decades. If you think about the Walden program at Emory, also the Project Data in Washington, they've been around since, I think, the 70s or 80s. So a long time, but they haven't really taken off. Very few of them have been replicated in community settings in a way that are sustainable. And I think the challenge is that what we expect teachers to do, how we expect them to blend individualized supports and intensive intervention is really difficult to achieve in community settings. So we wanted to take a tiny step in the direction of what it would take to move this kind of intervention model into the community. So what we came up with was a stepped care model. So this phrase, if you don't know, a stepped care model sort of comes out of the medical field. It was really became sort of a term in autism with the 2022 Lancet Commission report for the future of care and clinical research in autism, where essentially the idea is, let's start with the least resource-intensive intervention first. And if that doesn't work, we can add more to it. Let's start simple. So this is the overall framework that we try to do. Let's move into preschools, offer them something very simple. And if that's not good enough, then we look for something else. We wanted this intervention also to be transdiagnostic, which meant we cared about autism, and a lot of what we taught was informed by autism, but we thought and felt that what we had to offer really applied to many children above and beyond children with autism as well. So this was not just for autism, but for other groups as well. And I think this is particularly important when you think about classrooms for 2- and 3-year-olds, because many kids who go on to have a diagnosis of autism at this point don't. So many teachers, most preschool teachers have 1 or 2 children in their classroom that somehow seem to have fallen behind in terms of their social communication development. Some have a diagnosis of autism, others don't. But those are the teachers and children we try to support with this. And we also didn't want to teach teachers about autism. What we decided to do, actually, when we talked to them, the word autism didn't come up much. What we instead talked about active engagement. So what can you as the teachers do to help those children who struggle with communication become actively engaged during classroom routines? So that was sort of our approach. And we sort of did this by adapting an intervention that was developed by Emily Rubin. She calls it the Social Emotional Engagement, Knowledge and Skills Program. Emily Rubin is a CERTS author. And we found this a very helpful framework for us to think. What's really central about this framework is that she also puts active engagement at the center of everything, and she breaks active engagement into 3 dimensions. So how can teachers see that their children are actively engaged? She would say there are the 3 I's. There's children need to be invested, they need to be independent, and they need to initiate. Children are invested when they pay attention, their attention is sustained, when their faces are full of joy, and their bodies are oriented towards others. So they're invested if they are motivated to be where they are. Their independence, when they can anticipate and imitate other people's actions, when they can follow routines, when they respond to visual schedules or contextual cues. So if they know what they're supposed to do in the classroom, then they're independent. And they initiate a lot when they communicate frequently with a range of people for a range of reasons and so forth. So it's really, the intervention was sort of, the goal of the intervention was to help teachers make sure that all kids, especially the kids with social communication challenges, were actively engaged. And for our intervention, we focused specifically on large group circle time as the context where we tried this out. So we developed a 10-week program focused on large group circle time activities. We had 4 asynchronous, so meaning self-paced online modules the teachers would complete. And we had the online modules. I put a still frame here. The online modules had lots of videos in them. Lots of the videos have sort of prompts. So here, for example, there's a child is circled, and then there's sort of an assignment for the teachers to pay attention to something and afterwards respond to a question about it. So we tried to design these modules very interactive. Preschool teachers do a lot of these online modules for continuing education, and a lot of them are really boring and passive. So we try to be very active in, giving the teacher an active role in how they could engage with these modules. So 4 modules, and then interspersed in between the modules were coaching sessions. So we send a student out to take classroom videos, and then during the coaching sessions, the teacher and a coach reviewed the videos. And I said there were 4 modules, so 3 of the modules, there was a module on investment, a module on independence, a module on initiation, and then following each module, the coaching session would also focus on investment, independence, and initiation. And we use this appreciative inquiry framework, which essentially is a way of saying, we think that teachers learn the best if you first start by appreciating all the wonderful things that they do, and help teachers appreciate themselves when they watch themselves on video, all the wonderful things that they do and their children do. And then you engage the teachers in a conversation and ask them to imagine what else they could do that would help the kids be even more engaged. So I think that was the framework for our coaching sessions. So during the online modules, they learned a lot of the tools. During the coaching sessions, we help the teachers sort of look at their classroom and think about which of the tools may apply or be useful to them and how they would apply. So we did, in this study, we spent a whole year talking to teachers and get them to help us adapt the intervention. So there's a whole implementation science component to it. And then we had spent a whole year trying it out with 25 classrooms. And so 25 classrooms. For the 25 classrooms, we tried very hard to make sure we had a range of preschool classrooms. So we had Head Start classrooms, we had privately funded childcare classrooms, we had pre-K classrooms affiliated with school districts. So we wanted to make sure we had the entire spectrum of early childhood programs participate in this. I think I'm looking at the time. I'm going to skip a little bit through some of the data, but essentially this was a feasibility study. So it was not a study to test whether this study helps kids with autism learn necessarily. It was more a study of, well, how does it even work? Would teachers be interested in learning about an intervention like that? Would they find it acceptable and helpful, the teachers? Would they make it through it? Would we be able to find children who qualify? So essentially what we do is we worked in 25 classrooms, 8 in public schools, 5 in Head Start programs, 12 in childcare classrooms. For each classroom, we recruited a teacher-child pair. So we started by recruiting a teacher, and then we asked the teacher, identify one child in your classroom for us. And for me, this is a very important approach, that you start with the teacher and then find a child in their classroom. Because if you think about a preschool director running a school, they essentially want to train all their teachers, and they want to give all their teachers skills, not just the teacher who has by accident a child with autism in the classroom during this school year. So we started with the teachers, recruited the teachers, and then we identified a child with autism, a child in their classroom. And in identifying the child, again, it was transdiagnostic. So we're not just looking for kids with autism, also, but not just. So we guided them through a stepwise process. So essentially, we asked them first, is there a child with autism in your classroom? If yes, that was the child, that was the focus. If not, we would ask, well, are there other children with other developmental, behavioral, or social disabilities? If yes, that would be the child. If no, we would ask, well, do you have a child in your classroom who has difficulties engaging in classroom routines? And there was also a screening measure that came with that. And then the child that the teachers were most concerned about was the child that served as the target child. It was a very diverse sample, in part because we had Head Start classrooms. In talking you through the feasibility of this, to me, in some ways, the first slide here is the biggest one. So were we even able to make this work? And who would the kids be that you enroll if you go down that road? So we had no problem finding the teachers. So we tried to enroll 30. We enrolled 31, which was great. We had, for 80% of the teachers, were able to identify a child that they were concerned about, and the parent also consented to participate. So essentially, finding a child was a fairly easy task for the teachers. Not all parents then went the step ahead and consented. But overall, we felt very successful. And when we looked at the children overall, so we collected two measures, the SRS and the SSIS, which are both parent rating forms on social concerns or social skills. And on both of these forms, the average was at least a standard deviation below average. So these kids didn't have autism, at least not now. I think a small number did. 4, I think, had, but the others didn't. But they all had significant delays or concerns in the area of social communication skills. And then I'm going to scroll through this, but essentially the intervention turned out to be very feasible. So we met all of our recruitment and enrollment benchmarks. The teachers were really good at completing SEEKs. 76% completed SEEKs. 79% completed at least 2 coaching sessions. 79% completed all 3 online modules. I think 79% also completed at least 3 hours, spent at least 3 hours with the online modules, which is quite astounding if you think about a childcare teacher in the community. And we had a pretty robust pattern of gains. Fidelity, so teachers started using the strategies that we saw. Teacher self-efficacy, teachers felt that what they learned was helpful. How teachers viewed the student-child relationship improved. Observed active engagement of children didn't significantly improve, but that didn't concern us too much because it was a feasibility trial. And we actually had significant gains on teacher-rated social communication skills. So overall, the pattern to us seemed quite strong. I don't think I have time to tell you much about the second project, but essentially it's the same framework that I just described to you. So this is a project we just started here, where we're essentially trying to think about, well, what is the teacher's role in engaging parents? And what are the challenges that they face, particularly when it comes to engaging parents of children with social communication challenges? So you guys all know, and I put here the NACI guidelines for developmentally appropriate practices. They have a lot of ideas for what teachers, general education preschool teachers, are expected to do when it comes to engaging parents. Respectful reciprocal relationships, regular free two-way communications, welcoming families in the settings, respecting families' choices, sharing knowledge about children and child development with families, involving families as a source of information. So preschool teachers, if they're doing it well, think a lot about families and children, and they have a lot of processes in place to engage them, because they realize that if they don't engage them, well, by engaging them, they help their children learn. So that's sort of one source of information. And at the same time, the naturalistic developmental behavioral interventions have a lot to say about strategies to teach parents with their children. So there's a whole literature on parent coaching intervention about strategies that have been successfully taught to parents. And also NDBIs have thought a lot about how you actually work with parents and how you engage parents, how you talk to them, how you coach them, how you embed things and make things meaningful for parents. So the goal of the project that we are doing right now is to work again with stakeholders from a range of preschool settings, state leaders, preschool directors, preschool teachers, and parents, to think about all the things that preschools already do to engage parents, the specific challenges they face when they engage parents of or encounter parents of children with social communication challenges, and then maybe develop a professional development program for them that helps them to also leverage some of the tools that autism interventionists would have for helping kids learn or for engaging parents. So the idea is, again, to develop a professional development program for teachers that helps them be more effective in engaging parents, particularly parents of children with social communication challenges. Just going to pause back. So I've just talked you through 20 years of my life, but I think also a pretty big swoop in the history of autism science. And I'm just going to take a moment to reflect back to you what I think we've learned. I mentioned earlier on that my thinking about how children learn really hasn't changed that much. I still believe, just like I did 25 years ago, that also children with autism benefit when parents are interested in, pay attention to, and follow their lead. That is sort of a basic principle of learning and development that I've sort of maintained. And I think the field has sort of, in many ways, learned to appreciate as well. But other things have tremendously changed. The timing has changed. I told you about the earlier study where we barely had any kids younger than 3 years in our sample. At this point, really, when we think about early intervention and parent coaching, we think about 1- and 2-year-olds, or at least that there's an opportunity to start there. As I said, intervention approach, the field has really shifted away, or is in the process of shifting away from decontextualized learning towards learning in natural environments. And obviously, every kid is different and every kid needs different things. But as a field overall, I think we've learned to appreciate learning in natural environments and the importance of it. Our research questions, when I look at intervention research, has really changed. We used to be obsessed with, or we used to think intervention research meant efficacy trials, sort of testing whether our intervention principles are effective under ideal conditions of a research lab. That was where we started out 15 years ago. I think at this point, we're much more concerned with, well, how do we make these evidence-based practices actually useful to providers in the community? And I think that's a huge shift to the field. Thinking broader about the field, the service system has really changed. And a lot of this had to do with health insurance reform and health insurance coverage for autism services, which really has changed the field tremendously. So there are now actually viable ways for disseminating interventions for kids with autism. They're not ideal, and there's lots to learn, but there are some that weren't there 20 years ago in the same way. And like I said early on, I think our views on disabilities have changed radically. And now we are much more respectful of difference, we're acceptance, we are valuing children's participation and inclusion in their communities much more than we did decades back. So now I'm at Kristin Farmer Autism Center for three months now. And we've been thinking about what to do with that, like what Kristin Farmer Autism Center should be and where we want to go. And I think one thing that's very important to us, so I put here this term of ecosystem of care this is really a term that Ami Klin uses when he talks about Marcus Autism Center, but it sort of reflects a conundrum when you direct a center of this kind and do so in ways that sort of appreciates naturalistic learning. And the conundrum is you really don't want the children in your building. You want to teach them outside the building. So there is a place for children to come to our building, but then or to get services from us. But really, what's important to us is to transition the kids out in the community as quickly as possible. So I think when you direct a center of this, it's very important to me to recognize that children outside the building are as important to us as the children inside the building. In many ways, I'm saying this because the function of a center like ours is not obvious. The function is not that all kids should come for services to us. That's not at all what our mission is. In fact, our mission is to take responsibility for becoming an architect for an ecosystem of care for autism in our community that our building plays a role in, but that really happens out in the community more than inside the building. So this being said, so what do I mean by an ecosystem of care? So I think what happens to us, and I think a lot of you guys are intervention providers or service providers, we are trained in a certain way, we have a certain service that we offer, and we sort of think in that box, and this is what we offer, and we don't think too much about other things. And I think a lot of us service providers do this, and I think that's great because we all sort of stay within things that we're competent in. But I think there's also a need for someone to look a little bit outside the box and sort of look broadly about what children with autism need in all these different areas, not just based on what we have to offer, but based on what children need. So who needs what intervention and where should it be delivered? How do children's intervention needs evolve over the lifespan? And then with all of this, I think one of the challenges that you guys as Lens Center thinks about a lot is how do we bring disciplines together? How do we integrate settings? How do we integrate systems? So I think when I think about an ecosystem of care, it's about all of that. So who needs what intervention and where, to sort of come up with a broad swoop, making sure there's a place for families to go, whatever their need is. Some of them may be here at KFAC, but other services should be somewhere else. Making sure that we have something available that covers the lifespan, and particularly pay attention to how we transition across discipline settings and systems. So for KFAC specifically, what role do I think we play? And I don't know. I mean, I've just been here for 3 months, but there are sort of a few places where I think I want us to think about. So I think there's a place for us as a center to really think one more time about services that are being offered elsewhere as well. But think about them in a way that maybe is novel. So I think we offer a lot of ABA services. There's a lot for young children. There's lots of ABA services in the community. But I may be overstating it a little bit, but the kind of naturalistic developmental behavioral intervention that I described earlier are not implemented currently in those community settings. So I think there's a room for us here at KFAC to really figure out how to do this well. So we've been spending quite a bit of time since I came here to think specifically about young children. And I'm sort of gradually developing graphics for this, but I think essentially what we want to do is sort of create 2 tracks for children. So by age 8, I think some of our children are going to be in special education classes and other children are in general education, kindergarten or elementary school classrooms. And we want to create pathways for both of those kinds of children. Obviously, when they're 1 or 2, we don't know which pathway they're on, but gradually we're sort of becoming more confident and we need to create these different pathways. We need to make sure there's some ability and crossover between the 2 as well. And I think there's a lot to learn. There's a lot to learn for us how to transition, how to individualize learning and adjust the curriculum and their goals as we go along. There's a lot to learn about how to transition kids from our program to inclusive setting to community schools. And there's a lot to be learned about how to support parents along the way, because obviously here on this graph are 8 years of a child's life. When I think about my parent coaching intervention, that was 12 sessions. So that doesn't meet the mark. So that's one thing. I think there's a huge role for us to play here at KFEC in terms of training and supporting professionals. I'm actually thinking the most these days about behavior technicians. So somehow our health insurance have sort of decided that the way we implement interventions is we have a BCBA who writes treatment plans and behavior technicians who implement them. Who are those behavior technicians? Well, those are kids with a high school degree and 30 hours of training in ABA. Mm-hmm. That's not enough. And the field has really not wrapped their mind around how we train that workforce. Supporting community classroom teachers. So when we transition kids into the community, making sure that these teachers are prepared. Also, obviously, UNT does lots of pre-service training across all disciplines. So preparing that workforce, I think UNT plays a huge role in. And then I also think for us, there's a big role to play just in terms of care coordination, being a place where parents come to get training, to get a diagnosis, to get resources, to find a community, and to get advice on where to go next and what to do. My last slide, I just wanted to sort of highlight that there's some of these things we can sort of tinker and figure out. For other things, we need to really think about the systems we operate in. I think there's really a huge need for community viable tools. So I think for a long time, I've sort of struggled with, should we brand the interventions that we develop? So if you think about my focused playtime intervention, I published the papers. And if you dig real deep down, you find the treatment manual and the parent workbook as an attachment, as a supplementary material that you can download from the website. But nobody finds that. So I manualized a lot, but it was never branded and sold. And there were no service deliveries or there was I never tried to spread it more widely than that. It was for me just a research study, really, although those tools are really valuable. Other people have branded their interventions like ESDM or Project Impact. And I think I've always felt very ambivalent about it because I've always felt that it sort of stifles my innovation, because then I'm sort of stuck with this model that's sort of written down and I can't change it. But I think we sort of we have to balance two things. On the one hand, health insurance wants us to be really efficient in how we deliver services. So with that comes the needs for tools that people can use off the shelf to deliver interventions. So when I think about, so I think we need tools. At the same time, we need to be flexible enough to innovate as well. So I think that's one thing. I'm really, really grateful and delighted that now families of kids with autism can leverage their health insurance for accessing autism intervention. But I think there's a lot to learn and improve when it comes to these health insurance codes. Somehow we've decided that, I've mentioned, so there's these treatment plans developed by BCBA that then implemented by a workforce of behavior technicians. Why BCBAs are the only people to develop these treatment plans, I don't know, and I don't think it's probably a good idea. I could easily see treatment plans being developed and coordinated by speech-language pathologists, by occupational therapists, by special education teachers, by clinical psychologists, and so forth. And I think that would make for a much richer and diverse understanding of how children learn. Also, I think the system as it is really lends itself to offering kids with autism 35 hours of one-on-one treatment, and how to get funded for all the things that we do to transition kids back into the community is really much harder to do with those health insurance codes. So I think there's a lot for us to learn and improve in terms of systems there as well. I'm going to pause here. I talked a little bit longer than I thought, but I think we have another 20 minutes or so for questions and conversation.
Yeah, it's great. So thank you so much for your presentation. It was very helpful, and I learned a lot by listening. So we do have a question. So how does your work center what we are learning from autistic adults about the harm of early intervention programs such as ABA? And how does your approach seek to not force autistic children to become neurotypical-like?
It's such a lovely question. You know, the field has come a long way. So I think, you know, when I sort of think about autism intervention, the first person to really, I think, put autism interventions on the map was Ivor Lovas in the 60s. I think it was the 60s. So it's been a long time ago. And I think he's done a lot of good to the field. He was the first person to really radiate some optimism that there's anything you can do to help kids with autism learn. I think he was the first one. I was at UCLA, which is where he was, even though I had little contact with him, direct contact with him. He had inspired, if you would look at who was inspired, he built careers in autism for tens of thousands of people. So many students that came through his lab, he inspired to pursue careers in autism. So I don't want to shortchange the impact he's had, but there was lots of things that he did that had a bad impact. He started out working with punishments, which obviously we would never do again. He also started out, and to some extent still works, in ways that is very sort of structured and gives kids little choice, and is very demanding and tries to shape children's behavior without giving them a voice in where they want to go, or even giving the parents a voice in where they want to go. So I think that, you know, it's a long field now, and we've done this now for 60 years, 50, 60 years of sort of behavioral interventions for kids with autism. And I think we've made a lot of mistakes, but we've also come a long way. And I think this framework of naturalistic developmental behavioral intervention puts at the heart learning in natural environment, and puts at the heart giving children choices, giving children and parent choices. So I think, I mean, we as our Autism Inclusion Network, one of the papers that we're working on right now is exactly that, trying to think about why we think inclusive preschool and naturalistic developmental behavioral interventions and the neurodiversity movement are really aligned movements and are in pursuit of very similar things. So I think, to me, you know, child choice is a very important thing when I sit down and play and interact with a kid. And it becomes even more important as individuals with autism get older and have more freedom and ability to make choices. So to me, it's very important. But I also have to say, from my experience as a parent, I think the experience isn't, I don't know if you guys know Andrew Solomon's book, Far from the Tree, where he sort of talks about different groups of individuals who are different from their parents' generations. And he sort of, so people with disabilities, people with different sexual orientations. And he sort of describes the experience of parents, where parents always are torn between two things. On the one hand, being accepting and loving their kid for whoever they are. And on the other hand, being worried about their child and wanting them to learn things and develop and grow in a way that makes their life easy. And I think as a parent, I think we all know this tension quite intimately. You know, we look at our kids sometimes in horror and sometimes in love, and we somehow need to balance those two things. So I think, you know, child choice, family choice is absolute where I want to go. But I think that, we have to sort of balance, appreciate our children for who they are, at the same time where we want to help them learn and develop, and where we think they're going to have a happy future.
Yes, thank you. Okay, so we have time now for some additional questions, so you can raise your hand or type it in the chat. Either is okay. So someone wrote in the chat, coming from an autistic adult who works with other autistic adults, a parent's choice should not supersede the needs of the child and should not force them to hide their abilities or learn what neurotypicals believe is superior to know.
Yeah, I absolutely agree. I mean, one of the great pleasures that you have as a faculty is that you meet a lot of college students, and a lot of college students with neurodiversity, who self-identify as somewhere on the neurodiverse spectrum. So at Emory, I taught a course every semester on autism. And over the years, more and more students in this class identify as and being proud of their neurodiversity, either because they have autism or because they have ADHD or because they have some other diversity issues. And it's really made all of our it changed the way we learn together, and it has changed the way we think about autism and we feel about autism. So I'm very grateful for the voices of individuals with autism in this conversation. I think it's a huge step forward for the field.
Yeah. I was just going to say that I love the way when you're talking about teacher interventions that you start with really talking with them about what they're doing well. And I imagine you do the same thing with parents, and it probably helps them to feel less like they're being examined or judged in more of a collaborative environment, which is what we all sort of need to learn in.
Yeah. I mean, I'm sort of struck by, I mean, I mentioned briefly earlier the behavior technicians.
Yes.
So here at KFAC, we have at the Kristin Autism Center, we have about 50 of those. So it's a large group of people.
Yeah,
most of them are part-time students. So they're all undergraduate students who have a high school degree, a couple years, in their undergraduate education. And I'm very curious about how we prepare that workforce. I think in ABA, generally, the approach is a very simple one. And the approach is you write a treatment plan, you make sure that the technicians follow the treatment plan to the bone. And there isn't much deeper thinking about professional development or helping people understand and grow professionally. And I find that very misguided. I think when you learn how to interact with and support the learning of a young child with autism, being competent in implementing a treatment plan is only a small part of what you do. You do many more things. You implement a lot of supports in naturalistic settings outside the treatment plan, and how to build that skill. So I think teachers have sort of gradually learned how to, there are sort of this coaching literature for teachers. There's a coaching literature for sure around parents that uses that framework. I think for behavior technicians, it doesn't exist. And we essentially
sort of shocking that it doesn't exist, isn't it?
Yeah. Yeah. I don't think behavioral analysts think about implementation science a lot. I think that's sort of my impression. They write treatment plans and have the expectation that that's going to be implemented by the people who work for them, which are the behavior technicians. And if they don't, then there's frustration. But I think the approach really is to trust more in their skills and their professional growth. I mean, it's a very, the way this has shaped up in America, where you the health insurance sort of decided you fund someone to develop the treatment plan and coordinate it, and then you sort of fund a low education workforce to actually implement the treatment. That's how it's culturally merged here. It doesn't have to be this way. It's one way to get to intensity, but it's not the only one. If I think about the system in Germany, how it was 25 years ago, you would spend much more time with a highly trained person at the expense of having less access to less trained people. So I think we need to make decisions about how this should be. But for me as a college teacher, preparing those behavior technicians, creating career pathways for our undergraduate students is a wonderful opportunity, and I'm very excited about that.
Yes. Yes, I've had a chance to work with some BCBAs and RBTs myself. Okay, let me see if we have any more questions or comments. Someone said great information, thank you. And I'd like to open it up. We still have a little bit more time. If you have any questions or comments, you can raise your hand and then I can let you ask your question directly, or you could definitely put it in the chat.
I just wanted to maybe add one word about sort of the question about neurodiversity. Because I don't want to leave you guys with the impression that I feel like I've figured this out. I think we've all sort of during the last 5 years or so, something has changed, and the word of autistic adults has become much more accessible. I mean, we hear it much more. We hear people with autism speak out much more about what they want, making choices. That has always been around, I'm sure, but I think the field is gradually hearing it more. And I think there's really a lot for people like me to learn. I don't have all the answers. And I'm sure that at times there are ways in which the interventions we deliver don't give children the choices, and we don't give enough choices. Just like as a parent, we sometimes don't give enough choices to our children, make decisions for them. I think all I want to say that I'm really excited about figuring out that balance, and I'm excited about people with autism reminding us of these things a lot.
Yes. Another person asked, let's see, any resources for BIPOC families and ASD teens?
I don't know. I feel like I'm so new here in Dallas that I'm not the right person to provide resources at this point.
Right, I can share a little bit on that. So I'm here at the University of Texas at Austin, but in my previous role, I was with the Autism Society of Texas, and they definitely could help. And I'll go ahead and just drop their information in the chat. They have a line. You can email them or call them, and it's a program called Navigating Autism, and they can get you linked to support. There's also a really great national resource called AANE, and they have many support groups for teens, for BIPOC families. They have a lot of really great resources that they used to be free, but I believe they've had such an influx of requests that now they're charging, but they may have some sliding scale options. So I will put that in the chat.
Thank you.
Sure. And let me see if anyone else raised their hand. Nikki, did you have a question, or was that just an accident earlier? Okay, I think that's all of our questions for now. And I just wanted to make an announcement that next month, on Friday, December 8th, we have a presentation on culturally tailored health education for Latinx families of children with intellectual and developmental disabilities. And we'll be offering a free CEU again, and we hope that you'll join us. And I'll be sure to post it on our website and on our social media channels, where I think most of you found out about this presentation. And then I just wanted to say again, thank you so much for joining us, Dr. Siller. I really learned a lot and enjoyed it.
It's been a pleasure. Thank you so much for having me.